Okay, sir.
Thank you, sir.
So, good morning to all. I'm Dr. Prasad Babu, Deputy Director, IGNOU Regional Center, Vijayawada. Today we have scheduled MA Psychology second year clinical psychology specialization online counseling sessions. So today morning 10:30 to 12:30 MPC 0011, afternoon 2:30 to 4:30 MPC 00012, and tomorrow afternoon also MPC 013 psycho interventions in clinical psychology. So these three papers will conduct through online. Already internship MPCE 15 we have conducted Friday 4 to 5. Already Vimla madam has taken this session. And regarding practicals, we are planning to schedule. Once it is confirmed, we will inform you. I think March or April we conduct the practical sessions. Meanwhile, already we have forwarded previous YouTube links to all the learners. So please go through those YouTubes. If you have any doubts, you can write on the papers. While coming for the practical sessions, you can ask the questions, or otherwise during the sessions, clinical psychology sessions, you can ask Rafi sir. Rafi sir also will clarify your doubts. So now sir will start the session. So Rafi sir is a assistant professor in the VIT University, Andhra Pradesh, Amravati. Uh, he has been associated with for a long time. Recently has come from Punjab to VIT AP, and we are utilizing his services since he has been associated with IGNOU as academic counselor for MSc Counseling and Family Therapy and MA Psychology. So because of he belongs to clinical psychology specialization, we are utilizing his services for the clinical psychology papers. So, and already I informed day before yesterday, Friday, those who are going for the internship program in clinical psychology case studies. So regarding, I have mentioned two aspects. One is agency supervisor, another one is academic counselor. So another part, academic counselor part, Rafi sir will take care of. So all the clinical psychology students, once you go to the agency supervisor, write one case study and show to the Rafi sir. Once he is approved, you can carry the other case studies. Every three case studies, just you can forward to the sir, and sir will see, and he will give any inputs or suggestions like that. Based on that, you can continue. So three times you can contact with the sir. After that, you have to get the marks for 30 marks. So already I informed Friday. So this is the information from my side. So sir will take now to 12 o'clock or 12:15. Last 15 minutes, if you have any doubts, he will clarify. In between, don't raise any queries. Sir will continue the session. So last 10 or 15 minutes, if you have any doubts, you can ask the questions. Sir will clarify. Now, thank you very much, sir, sparing
Welcome, sir.
time and interacting with our students. This is a counseling session, not for the regular teaching activity. So, sir will give you the inputs. Already has prepared a lot of PPT slides. So, he will give you in deep. Thank you.
Welcome, sir. Thank you, sir. Okay, good morning, all. So we will be starting with our session now. Just let me share the screen. I hope my screen is visible, right?
Yeah, yes, sir. Yes, sir.
Yes, thank you, sir.
That's visible.
Okay. So psychopathology we are going to discuss today. Psychopathology is the study of mental disorders in terms of their cause, development, course, classification, and treatment. So, pathology to understand the etiology, to understand the reasons why this problem a person is having. So, for that purpose, to understand different etiology about disorder. For example, we have example of depression. Why a person is having depression or OCD, Okay, so what would be the causes? There can be a number of factors which are triggering to depression. Okay, to understand that all, what all, it can be genetic, it can be because of environmental factors, it can be because of personal reasons, it can be because of a number of other reasons. So to study that all, we will be discussing that all reasons in this paper. So foundation of psychopathology we have. So let's go through brief history from where it started actually. Psychopathology, the journey of psychopathology. So it's not so recent, it has been there in ancient times as well. So the ancient human civilization believed that abnormal behaviors are caused by some supernatural magic. Even though, like nowadays, also still some people have that belief that if you do something, it can be because of magic. Even in villages, in many areas, people have that in their mind that okay, this problem is because of this thing, right? Even our parents used to say, you, if you did not do, recently one of my students said that I had non-veg, so my parents said your problem is because of that non-veg. So people used to believe that it is because of magic, it is because of evil spirits, it is because of moon, stars. So all the reasons they used to keep there. Okay. There was strong belief that our behavior, effects, and thoughts are governed by supernatural entities, divines, spirit, and all. Okay. So even you might have heard about witchcraft, demonology, and moon stars, mass hysteria. So these all were even I still remember in most of the areas nowadays. Also, people are saying I am getting this because that person have an evil eye on me. So these beliefs are still among people, right? So it was from ancient only. Now we have different models. So even during ancient as well, they have given different models. It's not only like they had beliefs about that, but there were different models. So biological model is one, psychological model is another one, behavioral perspective is another one. So for example, if a person is having headache, he is going to a physician, right? Physician will write some medicine. If the same person is going to homeopathy doctor, they will also allopathy. Then there are n number of other psychologists, they will also this psychiatrist, they will also give medicine. So wherever you go for one single problem, the perspective will be different. I will say it is because of psychological issue, another person will say it is because of biological issue, another person will say it is because of some other issue. So that all, that's why we have biological model. So let's see what biological model is. Early Greek contributions, Hippocrates and Galen. So they believe that abnormal behaviors have natural causes. Health is determined by four humors. So they have talked about four humors that are blood, black bile, and yellow bile, then cold plague. So these are the four things they have discussed about. So Galen adopted Hippocrates' theory and advocated that the four fluids related to the Greek environment, concepts such as heat, blood, dryness, black bile, moisture, yellow bile, and cold fluid. Okay. In 19th century, J.P. Gray and Kraepelin, Kraepelin, J.P. Gray theorized that mental disorders, insanity, was always due to physical cause. So again, some people always believing that it is because of physical cause, especially like Kraepelin are great. Causes and emphasis should be on rest and diet. So what they focus on to us that you need to take proper rest as well as proper diet, proper room temperature and ventilation. So there should be proper room temperature as well as ventilation to be fit. Emil Kraepelin contributed in the area of diagnosis and classification of psychological disorders. Diagnosis, for example, if a person has symptoms of some sort of disorders, So how we are going to diagnose it? Diagnose means clarifying, okay, this person is having depression, this person is having anxiety, this person is having stress, right? Classification of psychological disorder, and they classified psychological disorders into different categories: mood related disorders, personality related disorders, right, brain related disorders, childhood related problems. So categorization. 20th century insulin shock therapy and electroconvulsive therapy, these were the therapies which were used to treat some sort of psychological disorders. So Joseph in 1920 observed that schizophrenia was rarely found in epileptics, which later did not prove to be true, and his followers concluded that induced brain seizures might cure schizophrenia. So ECT was used extensively and frequently by doctors. So schizophrenia is a psychological disorder in which people have symptoms like hallucinations and delusions. If you might have watched a movie, Beautiful Mind, which is on the basis of that is a true story of John Hash, who is a Nobel winning person who had got Nobel Prize in mathematics and physics. So on that basis, they prepared a movie. He had schizophrenia, right? So so earlier, what ECT was used for schizophrenia. Psychological approaches. Now we will see that was about biological approach. Now another approach is psychological approach. Early psychological approaches were Pinel, William Take, Benjamin Rush, and Derotrex Tex. Okay, in that we have psychoanalytic approach. In psychoanalytic approach, the famous personality who have done a lot of contribution to psychology is Sigmund Freud. He emphasized on internal mental process and childhood experiences. So what he said, if there is any sort of disorder, it is because of internal mental process, the way we think, whatever is going on inside our brain, it is because of that. And another point he mentioned is because of childhood experiences. So he believes that if childhood, that's why he has given developmental stages as well, he has given personality stages as well, he has given structure of mind as well. So he believed in that because these are the reasons for any sort of psychological disorder. Core elements: analysis of mental structure. So he gave mental structure, or we can say levels of consciousness, another stages of psychosexual development, anxiety and defense mechanism, psychoanalytic therapy. We'll see one by one what it is. So analysis of mental structure, human psyche, id. So he gave, it is also called as personality, structure of personality. So he talked about id, ego, and superego. Id is present with all of us in childhood, since childhood only, since we are born. Okay, so it means when, for example, if you might have seen any baby who is in your family or in your relatives family, whatever they see, they feel that that thing has life. Whatever they see, they feel that it is edible. You might have seen kids putting everything in their mouth, right? So they get pleasure from that. Even if there is a socket, they will put finger in that. They don't know about the consequences. So it is pleasure principle. That's why it is always known as pleasure principle. I just need pleasure, right? That's why they will play. Even mobile phone, they will put it in the water, right? They get pleasure in that. They don't know the consequences, what is going to happen after that, right? That's why it's called a pleasure principle. Then ego comes. Ego is reality principle. If I put my mobile phone on in water, it is going to get damaged. Then I have to spend more money on it again, right? That is reality principle. If I put my finger in this socket, I will get current. That is reality principle. And then comes superego. Superego controls both id and ego. Okay. So what is superego? It is morality principle. Here we know in ego what are consequences. If I do something, this is it. But moral principle is whether it is ethically acceptable or not. Nowadays, you might have seen the situation in our India. Lot of crime and all are happening. What is that? If a person is drunk, they are not aware. They just need pleasure. They can do anything. They can comment on anyone while walking. They can do anything. So they are in id stage, pleasure principle. When a person is in drunk, right? They just need pleasure. Reality principle is if we are trying to get that pleasure, what will be the consequence? They will be behind bars, so police somebody can file case against them. Morality principle is whether it is ethical to do this or not, right? So we need to understand that as well. Okay. Then we have another concept by Sigmund Freud is levels of consciousness. So in levels of consciousness, he talked about three levels of consciousness. One is conscious stage, another is preconscious or subconscious, then unconscious. Conscious means right now you are in class, you are listening to me. It means you are conscious, right? You are able to understand the concepts. It means you are conscious. Subconscious or preconscious means when a person is in ultra stage. You are in the class, but in thought process you are somewhere. Especially ultra stages when a person is drunk or on alcohol or on antibiotics. You might have seen people, they won't be able to properly observe things. That is what is preconscious or subconscious. Another is unconscious, coma, deep sleep. Whatever is happening in surroundings, they are not aware about that. So that's what unconscious is. Then Sigmund Freud gave another theory, stages of psychosexual development. So in stages of psychosexual development, he gave five stages: oral stage, anal, phallic, latency, and genital stage. So what he talked in these five stages is oral stage, right? So in oral stage, he talk about how a baby is involved in sucking behavior. That's very important to understand. Sucking behavior. Sucking behavior means when babies are having mm, milk, so they get pleasure from that only, isn't it? So when babies are having, so the age range for oral stage is 0 to, some books are suggesting 0 to 18 and some books are suggesting 0 to 24, so don't get confused with the age range. Okay, even if you write 0 to 18 you will get marks, even if you write 0 to 24 you will get marks. So most of the uh, writers are writing it as 0 to 24 first 2 years, right? So that's what oral stage is. Then we have anal stage. Oral stage also, Sigmund Freud said one more important point. So he said if there is no gratification through oral stage, then what will happen? People will be engaging in behaviors like smoking. That is again mouth gratification, right? So he said those kids who are not getting it, is as per Sigmund Freud, not as per me. Even there is criticism as well. So he suggested that those who are not like who are not having properly this pleasure, this stage is not properly with them, then what is going to happen? They will have problem with this. They may go for smoking, drugs and all. So that's what he suggested. Okay. Then we have anal stage. Anal stage is from 2 to 3 years or 18 months to till 3 years. Anal stage, Freud focused on toilet training. So he suggested that during anal stage, people usually will be engaged in toilet training, kids, right? Just a second. Okay, so what he suggested is kids will be busy with toilet training. So the children's focus shift from their anal region to the as they begin to learn to control their bowel movements. Children may experience pleasure from holding in or releasing their stool. If a child is punished too harshly or too frequently during potty training, so it is mostly related to potty training, okay, they may develop issues with control or become overly neat and orderly in their behavior. So in this stage, if children, when they are going for toilet, you should not ask them to rush or something. So what they will develop that OCD, neatly and orderly things. So example, a child who is punished harshly for having accidents during potty training may develop a fear of losing control or become excessively rigid and neat in their behavior. So this can happen as per Sigmund Freud. Then we have Felix stage. In this stage, the child focus turns to their genitals and they begin to explore their bodies more fully. Children may develop a sense of pride or shame around their genitals, okay, and may become fascinated with their parents' genitals. This stage is also characterized by the Oedipus complex, which is in boys, and Electra complex, which is in girls. So, what Oedipus complex is, where boys are developing sexual feelings for opposite sex parent. For example, boys have feelings towards their mothers and girls have feelings towards their fathers. So the example is usually when kids are from 3 to 6 years of age. So what usually boys will be acting like shaving like their father. That is obviously we have observed that. Girls will be acting like cooking, wearing sari, dupatta, and all, acting like their mother. Okay, and as per Sigmund Freud, they are feeling jealous of the same partner. If it is a boy, he will feel jealous of his father. If it is a girl, she will feel jealous of her mother. I'm talking about Sigmund Freud, not my again. Okay, so where the child develop. Okay, then there is another one more complex in this in Felix stage, that is called a Jocasta complex, which was given by later, not by Sigmund Freud. That was added in this theory later on. So Jocasta complex is Jocasta was a lady who was sexually liking, who had sexual attraction towards his son. Her name was Jocasta. That's why it was known as Jocasta complex. So, for example, a boy who develops sexual feeling for his mother and sees his father as a river may feel guilty or ashamed of these feelings and may try to repress them. So this is example of failing stage. Then we are going to the latency stage. In this stage, the child's sexual energy becomes dormant and they focus on developing social and intellectual skills. So here they what they are doing is in their preschool age. So they will be focusing more on developing social skills and intellectual skills. Children may develop close friendships with same-sex peers and engage in activities that promote their cognitive and social development. So you might have seen kids from 6 to 12, they will be having friends, especially same-sex friends, boys, boys, girls, girls. Okay. A child who enjoys playing sports, reading books, or particularly in school activities may be in the latency stage. That's what latency stage is. Then he gave another stage called the genital stage. In this final stage, the children's sexual energy becomes focused on their genitals once again, but it in a more mature and socially acceptable way. So, adolescents may develop romantic relationships and engage in sexual activities. Individuals who have successfully navigated through the previous stage will have a strong sense of identity and healthy sexual outlook. For example, a teenager who develops a healthy romantic relationship and engages in sexual activities with their partner may be in the genital stage. So 12 years onwards. Then again their focus will be on their genetics, right? They will be in teenage usually. They will be engaging in relationship and all, right? It is important to note that all individuals will pass through these stages in the same way or at the same rate, and some may become stuck in a particular stage, which can lead a personality to a personality or behavioral issue. So, what he said, Sigmund Freud, if usually he said most of the student, all the children will pass through all these stages, right? But if there is anything like they get stuck in one or other stage in out of these five stages, then there is a probability of having personality or behavioral issues. Additionally, modern research has challenged some of Freud's ideas, and psychosexual stages should be viewed as a theory rather than a hard and fast rule. So there is again criticism that some theorists right now are challenging it, and it's not as a like hard and fast rule. It can be a theory, like there are n number of theories on development, so it is also one of them. It's not hard and fast that what he mentioned that all individuals have to pass through these all stages. Then criticism to this theory is lack of scientific trigger. The psychodynamic approach relies heavily on subjective interpretation of behavior. So what is subjective interpretation of behavior? Subjective is, for example, I am asking you a question. Did you guys had breakfast? You will say yes or no. That becomes objective. If you start saying that, actually, sir, I woke up late, then my mother was cooking food, so I did not like the taste properly. I had little bit, but I feel it was not enough or something. So this all is very subjective. Okay. So same way, what criticism he got on his theories was that the theory bases are on the basis of subjectivity. Okay, interpretations of behavior, thoughts, and emotions. So whatever interpretation they did at that time, it was on the basis of subjectivity, which can be difficult to measure objectively. So obviously it is difficult to measure something which is very subjective in objectivity manner. This has led some crisis to argue that the approach leads scientific rigor and empirical support. So that's what there is some criticism or argument that this all needs to be empirically supported. Overemphasize on early childhood experiences. So another criticism on Sigmund Freud was they have overemphasized on early childhood experiences. The psychodynamic approach places a great deal of emphasis on the role of early childhood experiences in shaping personality. So, what some criticism are saying that Sigmund Freud has given overemphasis on childhood related experiences. So he has said if there is a childhood trauma, because of that only there may be a psychological disorder ahead of that person. While childhood experiences may certainly be important, Criticize argues that the psychodynamic approach overlooks other important factors such as social and cultural influence. So, what was the other criticism was that psychodynamic approach, psychoanalysis approach, have more focus on childhood related experiences, but they have skipped about the social and cultural influence, right? Okay, then third limitation is limited applicability to diverse population. So the psychodynamic approach was developed primarily in Western culture and may not be applicable to people from other cultures or backgrounds. Criticize argues that the approach relies too heavily on the Western perspective and may not account for important cultural differences. So this is again very important point. As we know, India is diverse in culture, right? So even if in India we have something, it is very difficult to generalize for whole India because we have diversity of culture, language, traditions, everything. So this theory was mostly applicable on Western culture. So that is again criticism. We can't generalize it throughout the world or throughout the population. Limited focus on behavior. So psychodynamic approach did not focus mostly on behavior, right? So psychodynamic approach places a great deal of emphasis on internal process and unconscious motivations. So it talks about internal process and unconscious motives, but may not adequately address the role of behavior in shaping personality. Criticizes argue that behavior is an important component of personality and should not be overlooked. So there are criticists who have talked about behaviorism, who have mentioned that behavior plays an important role, which was skipped by Sigmund Freud. Lack of testability. So the theory, psychology, psychodynamic approach or psychoanalysis theory, there is lack of evidence or testability. The psychodynamic approach relies heavily on concepts such as unconscious, which are difficult to test and verify using empirical method. Critics argues that the approach may be overly speculative and not grounded in scientific evidences. So what they suggest is that this approach is like mostly on particular, as earlier I mentioned, qualitative basis. So it is very difficult to have a scientific background on this, right? So this was about psychosexual development theory, which plays important role. Then he talked about three types of anxiety: reality anxiety, neurotic anxiety, and moral anxiety. So reality anxiety. Okay, so he talked about anxiety. Uh, if we see reality anxiety, so what is reality anxiety? Reality anxiety is, for example, a person, tomorrow I have exam. Okay, right now I am feeling anxiety about that exam. So it is on basis of some reality factors, right? Then we talk about neurotic anxiety. Neurotic anxiety is related to our, just a second. Yes. Okay. So what Sigmund Freud talk about neurotic anxiety is, it is again a form of anxiety of an individual's personality. Unlike normal anxiety, which is a neutral response to stress and danger, neurotic anxiety is a chronic and pervasive feeling of unease that can be seen unattached to any specific cause. It arises when an individual's defense mechanism can no longer successfully repress an early traumatic experience. So the important another concept what he has given is defense mechanism. So what he suggests is, when our defense mechanism is not working, so that time we are fail to face that. When we fail to face something, that time we will face neurotic anxiety, right? Then we have moral anxiety. Moral anxiety means, moral anxiety, what Sigmund Freud has, is an emotional. Actually, it is said that moral anxiety is an emotional that we experience when we are uncertain about the correctness of a moral decision. For example, sometimes we take some decision and we feel no, we did not do the justice. So that time, what anxiety, it will be related to our emotions that we are contemplating or having made. It is based on a feeling that one's internalized value are about to compromise. So, for example, a person is coming to me, that person is not able to score good marks to pass, but because of some reason I am giving 2 marks to that person to get pass, but I am feeling I did something injustice. The other students who already studied very well, they could not got it. So that is what is anxiety, right? Moral anxiety is a function of the development of the superego. Whatever the anxiety, the ego seeks to reduce it. So superego, that's why in superego we have a principle of moral principle, right? So in moral principle, what is like permissible, socially acceptable, we will be doing that, or what is in our principles, we will be doing that only. If something goes against our principle, we will start having moral anxiety. Okay, then Freud's list of basic defense mechanisms. So Freud gave another list of basic defense mechanisms. So defense mechanism. Before going to basic defense mechanism, we need to discuss what defense mechanism is. Right. So what he talk about defense mechanism? So Freud said each of us have a tendency for defending ourselves. So, individuals with an urge to do something forbidden experience anxiety. One way of reducing this anxiety is to express the impulse in a distinguished form that will avoid punishment, either by society or by its internal representatives, the superego. For example, I failed in exam. Okay, so I will say, oh, anyway, I did not had prepared notes. That is the reason why I failed, right? Or I did not attend most of the classes. That's why I failed. Otherwise, if I don't say this, then I will curse myself. Why did I fail? So to satisfy my superego, I have to do use the defense mechanism. When you are coming late to class, what you will say? You will never say, or even my students here, they will never say it was my mistake. They will say, sir, lift was crowded. There are students who will come from Guntur, who will come from Vijayawada, but those who are staying in the hostel, they will say, sir, lift was crowded. Sir, mess was not open early, or breakfast was not ready. So they are defending themselves from the punishment. Punishment means why scolding, why you are late to the class. Okay, so that's what defense mechanism is. When you are trying to defend yourself, to save yourself from anxiety or to save yourself from your superego, your morals and values. Therefore, defense mechanism is a technique used by the ego to keep threatening and unacceptable materials out of consciousness and so to reduce anxiety. It will help us to keep us threatening things away from us and unacceptable materials out of consciousness, which we don't want to say. And so to reduce our anxiety, it will help us to reduce our anxiety. Defense mechanisms are unconscious psychological strategies that individuals use to protect themselves from anxiety. So defense mechanisms are unconscious psychological strategies. So these are strategies but which are unconscious that individuals use to protect themselves from anxiety. If they are not saying that lift was not working, I will give them punishment that your attendance won't be given today. So to save from that anxiety or to protect themselves, they are using that. Okay, lift was not. So many times they will say, sir, I woke up late. They will not say it was my mistake. They will say, I woke up late. So because of sleep only, I am late. Again, we are making something else responsible for our mistake, for our doing, right? It can be either keeping protecting themselves from anxiety, emotional pain, or other uncomfortable feelings. If in class when a student is coming late, is getting insulted, why you are late? So if that person is not able to defend himself or herself, they will feel uncomfortable in front of everyone, so they need to defend that. These mechanisms operate outside of conscious awareness and are used to cope with difficult situations or emotions. So when they are in difficulty, now they have to respond to their teacher why they are late. That is a difficult situation. So defense mechanism will help them to take care of that thing. I hope you are with me, right? Are you with me?
Yes, sir. Yes, sir.
Yes, sir.
So then, first, this thing, defense mechanism, we will be discussing about denial. Denial is the refusal to accept a reality or acknowledge the truth of a situation. So I am not ready to accept the reality or truth. I am denial in a denial stage. Usually, people, I hope you might have read about this mental status examination. So there is one point we have insight level. So if it is one, they will have denial. Some of the psychological disorders where clients used to have denial. They will say, no, no, I am fit. I don't have any issue. These are my parents only dragging me to the psychologist. So that's what denial is. They are not ready to accept the reality or knowledge, the truth. It can be a defense mechanism that helps individuals cope with difficulty or stressing information. For example, a person who has been diagnosed with terminal illness may deny the diagnosis and refuse to believe that they are at risk. Sometimes, if you might have heard that a person was diagnosed with blood cancer, they will say, "Oh, it is not possible." A person, you might have heard that a lot of people nowadays who are doing gym and all, they are getting heart attacks, body cholesterol level high. So if somebody is saying me your cholesterol level is high, I will say I am doing gym, I am doing exercise. How is it possible? No, no, no. Some mistake has happened. The test is not mine. So that's what denial. We are not accepting the reality. Okay, then repression. Repression is the unconscious suppression of unwanted thoughts, feelings, or memories. It is defense mechanism that allows individuals to push away unpleasant or traumatic experiences that are too difficult to process unconsciously. I got my results and I have less marks. How I am going to face my parents if they ask about my results? So I usually will try to engage them in something else so that they will not ask me about my results, right? So we will try to repress that. Or another example is a person who has experienced childhood abuse may repress memories of abuse and have difficulty remembering or acknowledging what happened. Sometimes we need to say, hey, I saw today that person's face. I don't want to remember the past with that person. What happened? Uh, he did like this or she did like this. So we don't want to talk about that. Sometimes if you talk about, okay, usually if we have a conversation with people, okay, how are your parents doing? If there is some sort of conflict, sorry sir, or sorry dear, I don't want to talk about that, because that will give them more anxiety. Okay, what happened? Or with partner, how is your relation, how is your partner? Sorry, I don't want to discuss about that, it's giving me anxiety. Okay, if it is a toxic relation or something, so we are trying to repress that unwanted thoughts, thoughts which are making us uncomfortable, not unwanted thoughts. Okay. Okay, then we have another important and mostly used thing, that's projection. Projection is the attribution of one's own unacceptable thoughts or feelings onto someone else. It can be a defense mechanism that helps individuals avoid or deny their own issues by projecting them onto others. For example, a person who is jealous of their friend's success may accuse their friends of being annoying and competitive. I don't like my friend got first division. I will say him, you are very competitive. Otherwise, you would not have got first division. or I don't like somebody, I will say you don't like me. So I am projecting my thoughts. It is simple as when you might have seen in a classroom, we are using projector. Whatever is in our screen, like now I am sharing my PPT with you, so I am projecting what I am going to teach you. That's what projection is. What all my thoughts are, I am projecting it on other person. What I feel about other person, I don't like you, so I am saying you don't like me, actually I feel like that. So that's what projection is. Then we have rationalization. Rationalization is the use of logical explanations to justify or minimize one's own behavior. It can be a defense mechanism that allows individuals to avoid taking responsibilities for their actions or to make themselves feel better about a situation. For example, a person who cheats on their partner may rationalize their behavior by telling themselves that their partner was neglectful or unappropriative. You might have seen nowadays in our country, especially from COVID, the rate of divorce has increased, right? Separation between partners. So, rationalization. Why did you cheat this partner? Because she was not taking care of me. She was not giving me time, or he was not giving me time. That's why I found another option. So that's what when you are rationalizing your mistake or your behavior which is not acceptable. Why you are failed? If you ask students, because my friend did not help me in exams, because sir did not share PPT with me. So that is how you are rationalizing your fault. There was no electricity in the hostel, so I could not study. That's what rationalization is. Then we have sublimation. Sublimation is the redirection of unacceptable impulses or emotions into socially acceptable behaviors or activities. It can be a defense mechanism that allows individuals to channel their energy into positive pursuits. This is the most like my favorite defense mechanism. So, what in this defense mechanism people are doing is when I am very much frustrated or an individual is very much frustrated, very much angry, what they are doing is they are converting that unacceptable behavior, because if I show my frustration, it will be unacceptable behavior. That when I convert into socially acceptable behavior, that is what sublimation is. It can be a defense mechanism that allows individuals to channel their energy into positive pursuit. For example, a person who has aggression tendencies may channel their energy into a competitive supports or physical activities rather than acting out in violent way. So, as you know, sometimes we all have emotions. We all be getting sometimes angry. Okay. So if sometimes your parents are angry with you, you can't, even if they are wrong, you can't shout back or you can't show the aggression to them. So the best way to sublimate that anger is, you might have seen people who are getting very angry, they will go to gym. There, how much punch you want to give, you can give. How much energy you want to utilize over there, you can do. You might have seen even in movies we used to watch, when the person is very angry, they will go to gym. They will throw everything in their room out. So going to gym is socially acceptable. Nobody will say you that why you are going for gym. Nobody will say you why you are playing game, right? But instead of that, if you are hitting some person, then if that person is safe and files a case, again you will be under FIR, you will be behind bars, or socially it will be how dare you did that, right? So when you are changing that aggression tendencies are channelizing that in a proper way, socially acceptable way. See, fighting with one person is unacceptable. If you see people fighting on the road, it will be unacceptable. Police will come take them. Then what they need to do is they need to channelize that. Either using breathing exercise or using gym or using any other activity, so that there won't be any false or ill consequences. Another important defense mechanism is displacement. Displacement is the redirection of one's emotions or impulses into substitute target. For example, my boss is shouting at me. I can't shout back on my boss, right? So what I will do, I will shout on my junior, isn't it? Our students. So usually, even when I used to go to school, if our teacher is very angry, then we will diagnose that he might have fight with his or her partner today. That's why he is beating all students. So that was the assumption. But that time I was not aware about the displacement and all. So displacement is when you are redirecting one's emotions. You are very much angry because of your boss. Okay, what you are doing is now, even there are small reels on this Insta or Facebook. So husband is shouting at wife, or wife is shouting at husband. So what the other partner is doing, he is shouting at the kids. Okay, these are your, are the clothes, putting that hot iron for a long time, then clothes are gone. So that's what displacement is. Directly you can't face the same person, but whatever is associated to that, or whoever is who is not going to like wherever you feel dominance, so there you will use that. Okay. It can be a defense mechanism that allows individuals to express their emotions in a safe and socially acceptable way. A person who is angry with their boss may come home and yell at their spouse instead. This is the most common what usually happen. If a person in office has some sort of conflict or anger because of the boss or because of the work, when they go to home, obviously when the partner is coming or talking something little bit, then it will become more big argument because they are already frustrated. They want to take that frustration out. So that's what displacement is. Then another is intellectualization. Intellectualization is the use of abstract or intellectual reasoning to distance oneself from emotions. It can be a defense mechanism that allows individuals to avoid or deny emotions distressing by focusing on logical or rational explanations. For example, a person who has lost a loved one may focus on the medical or scientific aspect of death rather than the emotional impact on it. Okay, so if you remember, a few years back, there was a viral post. One person in MP, he had an auto, he converted it into ambulance. The reason was he lost his father because of lack of transport to the hospital. Then in his village, he asked that if anyone needs my, I will give free service to whole population. So that's what intellectualizing. Instead of crying for the father for long, or instead of being in that grief, what he did is he thought, okay, my father is now gone because of this problem. I don't want anyone else to suffer with the same problem. That's what intellectualization is. Okay. So then we have regression. Regression is the retreat to an earlier stage of development in the face of stress or anxiety. It can be a defense mechanism that allows individuals to seek comfort and security in familiar patterns of behavior. For example, a person who is overwhelmed with work and responsibility may regress to a childlike state and ask their partner to take care of them. You might have seen movie Munna by MBBS. I hope so, right? If you see the actress's father, whenever he is getting too much stress, he will laugh like a kid. That's what regression. When you are going to some other stage of your life, behaving like a childish, right? So that's what regression is. These defense mechanisms can be helpful in managing difficult emotions. So, defense mechanisms are really helpful for all of us to Be in safe situation during difficult situations. Right. Okay. Difficult emotions or situations in the short term. But if used excessively or inappropriately, remember this point. If we use defense mechanism excessively or inappropriately, they can interfere with an individual's ability to cope and to form healthy relationships. So, if every time you are giving the same excuse, so it will not help you to maintain a healthy relationship. If you are every time giving using defense mechanism, it is not going to help you. It is important to develop self awareness and to seek professional help if these mechanisms are interfering with daily life. So once you can defend yourself using defense mechanism, but if it is always, you are not going to be escape from such issue. So we need to understand that as well. Okay, so these were the list of some of the defense mechanisms. Then psychoanalytic therapy. Okay, then we have psychoanalytic therapy. Psychoanalytic therapy involves relieving repression, fantasies, and fears both in feelings and in thoughts. This process involves transference, that's projection of the attitude and emotions originally directed towards parents into the analyst. Okay, so psychoanalytic theory, I hope you might have heard about Rorschach. Rorschach's base is like that only. When we are projecting, if you see the images, we are trying to project our thoughts in that, or even TAT. We are making the stories. So whatever, when we do the analysis of TAT or Rorschach, projective techniques especially, so the base, the concept behind that is how we are projecting our thoughts, our fantasies, our problems on that. So, psychoanalytic therapy involves revealing repression fantasies. So that's why even interpretation of dreams by Sigmund Freud. So I have seen a lot of clients who will not directly tell their problem, what issue they are. If I fail, I am fail in all strategies, CBT, REBT, SLBT, okay, and I am not able to identify what actually they have the issue, because sometimes either the patient will lie because of lot of reasons, being a teacher or being like not very much comfortable, then or being something which is very much, for example, I have seen patients who are seeing like in their dreams or who have fantasies with their gods goddesses, okay, especially in OCD that problem happens, okay, so they hesitate or shy to share that problems. So in that cases we used to ask them, okay, what type of dreams you had. Then in dreams they will say, I had a weird dream. Through that we can understand, okay, what process, what issues they are going through. Okay. Then another important approach is humanistic approach, which was given by Roger and Maslow. These were the most prominent personalities in humanistic approach. So humanistic view puts emphasis on the positive aspect of life, free choices and personal growth. So this approach focuses on positive aspect of life instead of focusing on the negativity, or instead of focusing on um, uh, negative elements in our life. So they focus, their emphasis were on positive aspect, free choice, it's your free will, okay, and personal growth experiences. As you might have heard about the father of positive psychology, Seligman. So Seligman in the conference, what he suggested is, if you just Google about depression, you will get millions of articles on that. But if you say, if you Google happiness, hope, psychological capital, well-being, positive aspects, you will get very less work. So even when we are thinking about negativity, for example, if I am saying I lost my purse, all of you will feel so bad. If I say I got promotion, Even though I'm not going to give you treat, but still you will say, yeah, you will give that good smile, you will feel good, right? So that way only, when we talk about depression, we feel it as annoying word or as bad, right? When we talk about something, oh, I hope, right? Or self-esteem or resilience, okay, these gives us positive this thing. So that's what these people earlier, humanistic approach, they are focusing on the same thing. They focus on personal growth. According to this approach, abnormalities result from refusal to accept personal responsibilities for one's own actions and thoughts. So what they said, whatever abnormal behavior is, it is because when you refuse to accept personal responsibilities. You have to do this work. If you refuse to accept it, it may lead to some sort of behavioral issue or psychological issue. Human behavior is caused by the choice we make voluntarily. So what they are saying, whatever behavior you are making, it is because of your choice. We make it voluntarily. Features of humanistic approach: self and congruence, person centered therapy. So, these are two therapies which we will be discussing in another paper, psychotherapy. Okay, so I am not going to discuss it here much. Then we have behavioral approach. So, behavioral approach was most famous personality in this was Watson, John Watson, who is called as father of behaviorism. Then Ivan Pavlo and B.F. Sickner. Later on, Bandura also did a great work in behaviorism. Okay, the behavioral perspectives focus on the role of learning in explaining both normal and abnormal behavior. So they focus on learning, role of learning in explaining how normal and abnormal behavior is experienced. Concepts within this approach are classical conditioning. So in classical conditioning, what they did, it was done by Ivan Pavlo. Ivan Pavlo was a gastroenterologist who was dealing with the stomach-related aches problems. So he did one experiment with dogs. Okay, in that he tried to measure the salivation when that food is given to the dog, and simultaneously he used to have that bell. So what he did is he made uh, involuntary response as voluntary. Salivation in our mouth is involuntary response. It will come automatic when we see food, something good and all. Our heartbeat, involuntary. Our pulse rate, involuntary, which we can't control, right? Our breathing, involuntary, which is not in our control. Right. So what he believed in classical conditioning, what he did is he conditioned the dog with that bell. So for long time, what he was doing in that experiment is he was giving food simultaneously bell. So dog got conditioned to bell. So he thought whenever bell is coming, food is coming. So it was conditioned to that. Then on that basis, after some time, when the conditioning was done, food was removed. When only bell was happening, that involuntary response was coming. Still salivation was coming. That was his experiment. On that basis, we have actually one aversion therapy. We have, I think, yeah, this therapy, electric shock, we are giving for people who are having alcoholic related issue or drug issues, very low voltage. So whenever I want to do smoke, that time only I will get current. If I am getting conditioning to this, it will help me to reduce the smoking behavior. So that was about classical conditioning. Then we have operant conditioning. Operant conditioning was done by B.F. Sickner. In that, what he did an experiment on a rat who made he made a box with a lever. So rat was there, and whenever rat feel hungry, he used to roam here and there, and then suddenly once he put his weight on the lever and he got a food. Again he forgot. So after doing several trials, he learned that how to get the food. That was operant conditioning. That's what positive reinforcement and negative reinforcement they gave the concept. Then we had social cognitive theory. Social cognitive theory was given by Bandura. So what he did one small experiment. So he said learning is through imitation. His approach was on learning through imitation. So what he believed is we all learn through imitation, through observations. Okay. So he kept some kids in one room. He had two rooms. In one room, he kept few kids randomly. In another room, he kept few more kids, and both rooms were under CCTV surveillance. And both rooms had sitting arrangement, sofa, everything, and all. Then there were in both rooms that LCDs. In one LCD, in one room, he started the content which is very calm, like this Wiki Mouse like series. In another room, in another group of children, he started content like very aggressive, fighting, killing, hitting each other. So then he was observing the kids who were watching that Wiki Mouse, they were calmly sitting and watching, and the other room where the kids were watching aggressive content. So whatever material was there, they broke that all, they involved in the fight. So that's what he said, it is learning through imitation or observation. Whatever kids observe, they will do the same thing. So even if we have kids at home, how elders are behaving, they will try to learn the same thing. That was observational cognitive, social cognitive theory by Bandura. Then we have behavioral modification. Again, we are going to discuss this in psychotherapy, how we are going to modify the behavior. It can be because of, with the help of reinforcement, positive, negative reinforcement, or with the help of classical conditioning. Okay, then classification of psychopathology. So we have classification of psychopathology. So in classification of psychopathology, see, in this also we have, actually there are most commonly two classifications which we are using. Number one is ICD and another one is DSM. ICD is International Classification of Disorders and DSM is Diagnostic Manual, yes, Diagnostic Statistical Manual for Psychological Disorders. Okay. So, meaning and purpose of classification of psychopathology. Classification is scientific context refers to anatomy. It also refers to the nomenclature which describes the names and labels that may make up a particular disorder such as schizophrenia or depression. Five primary purposes of classification. Communication. So the first purpose of classification is communication. How we will communicate? Okay, this is what, right? So communication. So everyone knows paracetamol, composition of paracetamol, it helps to reduce the pain, right? Same way, it is already communicated. Everyone knows that. So communication plays very important role. When we talk about depression, we are, most of us, even nowadays, laymen also knows that what are the symptoms of depression. So it helps us to communicate. If I diagnose something, you might have seen, even when doctor is prescribing the this thing, medicine, it is not readable for all of us. So when it goes to the medical shop, they will easily understand, okay, this is that. That's what communication is actually. Or they will understand the technical part as well of that. Then control, it helps us to control the problem. Comprehension, distinction, pre-diagnosis. Okay, so these are the five things which usually classification help. If it is, say, sometimes there is comorbidity. For example, anxiety and depression has some sort of symptoms which are similar in OCD. Again, anxiety is common over there. So to get rid of these confusions, we need these five things. That's why we need communication, control, comprehension, distinction. So how we can distinct one from other one? Prognosis or prediction. What's going to happen? Three approaches of classification of psychopathology: categorical, dimensional, and prototypal disorder. Okay, we'll see. One second. Categorical as See, ICD and DSM, they have done, for example, in ICD, if you see personality disorders are separate in one chapter, and eating disorders are another chapter. So, on the basis of dimension, some are distributing it, on the basis of categorization, some are distributing it, or on the basis of prototypical approach, some are distributed. Okay. History of classification of pathology, ancient. Okay, this is already done. Okay, now we will see what is this ICD, as we were discussing that ICD and DSM are their two classifications. Milestone is disease in disease classification. The first international causes of death listed in 1893 lead to creation of the International Statistical Classification of Disease and Related Health Problems (ICD-1) by WHO in 1900. So first ICD book was developed in or uh, published in 1900. Development of mental disorders classification, it was only with ICD-6 in 1949 that a separate section for mental disorder. So earlier it was overall. Here if you see, it was milestone in diseases classification, and there we had a little bit about classification of disease and related health problems in this 1900 in the ICD-1. Then in ICD-6 there was a chapter on mental health mental disorders, which was included. In ICD-8 in 1972 introduced a comprehensive glossary for mental disorders. In 1972 in ICD-8 it was included. Then evolution of ICD-9 published in 1977 includes a greater clinical modification with volume 1 and 2 focusing on diagnostic codes, and volume 3 explaining procedure codes for mental and behavioral disorder. So this is how development of ICD has happened. Earlier it was like mostly on disease base, then they have done one chapter, then they have published two different volumes of it. Classification of mental disorders in ICD-10. So if you see ICD-10 classification, so it has codes with F00 to 009, organic including symptomatic mental disorders, dementia, delirium, organic. Okay. Then we have mental and behavioral disorders due to use of psychoactive substances. Again, these are disorders because of drug addiction or psychoactive substances. Then schizophrenia is F20 to F29. In that, all the types of schizophrenia, schizotypal, and delusional disorders. Then mood disorders affect is again F30. F40 is neurotic stress related disorders. F50 somatic syndromes associated with physiological disturbances and physical factors, eating, sleeping, sexual disorders. Then we have F60 personality disorders, F70 mental retardation, F80 disorders of psychological development, F90 behavioral and emotional disorders, and F99 unspecified mental disorders, which are not yet like. That's why if you see, there will be a revision in ICD, ICD-9, ICD-10, ICD-11 also is available now. So they are adding more, and now in recent one they have added some more related to this photography, selfie, and all. How it becomes this like addiction. Diagnostic and Statistical Manual of Mental Disorders, DSM. DSM first was introduced in 1952, then 1968 second, third 1980, 1987 third, R means revised. Then DSM fourth, even DSM fourth TR came, then DSM 5 in 13. Okay, so this was how DSM, a brief history about DSM. Okay. DSM 4th TR. I think in your syllabus, ICT 10 and DSM 4th TR is given. So DSM 4th TR has major three components, uh, features: the diagnostic classification, the diagnostic criteria sets, and the descriptive text. The diagnostic classification DSM for TR is categorical classification system. The categories are prototypes, and a patient with a close approximation to the prototype is said to have that disorder with qualifiers. So, even in DSM, we have diagnostic criteria in which if the symptoms, and even it is mentioned over there, the symptoms, like what are symptoms and what should be the duration of that symptoms. It's not usually nowadays we see, okay, we did not sleep today, we had this issue, so we are giving self diagnosis depression. So there the course, the duration, the symptom, at least out of these symptoms, these many should be there in the person from last 3 weeks, for example, especially in depression. From last 3 weeks, if these are the symptoms which are associated with the client, then only that will be diagnosed. So the diagnostic criteria. Each disorder includes in the DSM-TR includes a set of diagnostic criteria, including symptoms that are present and for how long. That's what I was talking. What is the duration of these symptoms? It's not today I could not sleep because I had tomorrow exam, so insomnia, right? It's not because like that. So we need to properly check what is the duration, how since how long I have been suffering from this, okay, whether it is fulfilling the criteria for whatever disorder I am uh, trying to understand, right? So that all is given in that descriptive text. The third component of DSM is to the descriptive text that accompanies each disorder. The text of the DSM TR systematically describes each disorder under the following headings: diagnostic features. So if we are giving diagnose, what features should be there? Subtypes are specific, recording procedure, associated features and disorders, specific culture, age, and gender. See, we can't diagnose somebody with Alzheimer's disease who is just 10 years old, because demographic variables again plays very important role. Usually, dysthymia, okay, is more found in females. So there are some disorders which will be towards particular gender, towards particular age. So that all we need to keep into consideration. Multi-axis classification. So it has axis 1 clinical disorders and other conditions that may be focused on clinical attention. Then axis 2 is personality disorders and mental retardation. 3 is medical, general medical condition. 4 is psychosocial and environmental problems. 5 is global assessment of relational functioning. Evolution of DSM-TR, validity and reliability, superficial symptoms. Okay. Unjustified categories. So these are what how evolution happens. So validity and reliability. Validity means to what extent it is measuring what it intends to measure. Reliability means consistency. Okay. Superficial symptoms. Superficial, as in initial history only I was talking about, there are beliefs about, like, it is because of this reason, it is because of that person I have seen in morning, that's why my day. So we have that superficial symptoms, or sometimes even in somatoform disorder there won't be any evidential symptom, but still we will feel pain and all, which is not clear. Unjustified categories, cultural biases. Okay, it's not. Developmental pathogens. Okay, risk factors. The risk factors model, risk factor model is a paradigm that facilitates the understanding of developmental deviations. It can be applied at any stage of development. Risk factors have been divided in three large categories: those at the level of the individual, family, and community. So one is individual. Individual is the person is having some sort of issue. Another is family, if the whole family is having, and then another is community. That is why, if you have heard about genogram plays very important role in diagnosis or even in like understanding the disorder. Okay. So if we see pathogens, it can be biological cause. Okay. Biological cause means when we have, in even in biological cause we have genetic means genetic vulnerabilities. Genetic means which are from our, so you might have heard that, okay, my father is diabetic, that's why I have a tendency to be diabetic. Especially in schizophrenia, the known cause till date is only genetic, and most of the psychological disorders, the known cause always is genetics. It is because of the genetic transfusion. So genotype, phenotype, serotonin transporter genes. So it is because of genes. So genetics means when from one generation the same problem is transferred to another generation. So usually, even if you see ads and all, hair loss, people are talking about genetic. Is it genetic? Diabetes, genetic. It is genetic causes. Then schizophrenia again. Then we have the neuroendocrine system. So neuroendocrine system, the imbalance in our hormones, okay, that also leads some sort of problems. You might have heard about, okay, the serotonin level or dopamine level is high, low, what's going to happen related to depression. Oxytocin, when you hug somebody, okay, you are feeling happy, that happy hormone is coming, so that is also coming under biology, right? And then we have physical handicap, pre or postnatal abnormalities, which can be led by prenatal or postnatal. Like that's why it's said when a person is in when a mother is pregnant, so the factors during the prenatal are responsible for abnormal behavior as well. Smoking, that's why we usually say the person who is pregnant should not consume alcohol, should not have such foods which will affect the baby's health, or should not be in the smoking area, or should not smoke. So that also, and if it is premature birth, right, that also leads to developmental disorders, abnormalities. Then if again, I was working with Suvikar Upkar in Hyderabad for some time. There I used to see the cases, most of the developmental delays were there when there is a lot of age gap between husband and wife. So husband is 40 years old, wife is 18 years, 20 years. I have seen most of the cases over there. Then marriage in relationship, cousin, first, second cousin, something. So that also is a known cause for childhood and developmental delays. Okay, early physical deprivation of basic physiological needs, stimulation and activation. Okay, so even early physical deprivation, for example malnutrition, if there is not a proper diet to the mother or the baby at early stage, that also leads abnormalities in among the children. Psychosocial cause, parental deprivation or separation, again very important. Kids need parental support. Okay, so if there is a parental deprivation, even most of the time psychologists use say, okay, domestic violence leads to childhood trauma. People who had domestic violence in their house, that also leads to lot of psychological as well as physical illnesses. People who have, just a second. Okay, sorry, I got a call. Yeah. So parental deprivation also leads to a lot of psychological disorders or physical childhood trauma. It can be physical abuse, psychological abuse. It can be any sort of abuse involved. Which will lead to psychological trauma. Parental psychopathology. If father has or mother has some sort of psychological problem, that will also cause problem in the kid. Okay, parenting style, again, be very careful with the parenting style, how you are treating your kid. That also, because nowadays kids are very sensitive. It's not. There was a time when in school teachers have sticks in their hands. Nowadays you won't find that. So we need to change the strategies how we are going to deal the kids. I have got a number of cases where kids are saying that they are going to file FIR against their parents because they are not talking to them properly, they are abusing them. Okay, so that style also plays an important role in childhood development. Inadequate communication, when there is not proper communication, that also leads disturbances. Disrupted family relationships, if there is any sort of family relationship issue, that also leads psychological problems. Socio-cultural cause, again another thing, the socio-cultural environment, in which environment you have been brought up, that plays vital role in our psychological well-being. Pathogenic societal influences. So if there is some sort of, that's why sometimes we ask our kids that okay, don't go outside, the kids are not, they have, if you are usually in different place where you will not allow your kids to incorporate with other kids there because of their language, because of their, you will learn rough language, we all always say this thing. So societal influence plays important role. Disorders endorsing social roles, where social role plays an important role. Social change and uncertainty, when even when people are shifted from one place to other place, that separation, that change, adaptation, there are a number of reasons that will lead to psychological related disorder. Childhood mental disorders. So most common and most dangerous, I will say, autistic disorder. Autism is a developmental disorder that is characterized by impairment development in communication, social interaction, and behavior. So those kids who have autism, the characteristics are they have impairment in development of communication. They won't be able to talk properly. Social interaction, they will not make eye contact with others while talking. They will be engaging in weird ways. And behavioral issues. Symptoms of autism. Okay, impairment in social interaction, fail to form the normal social contacts. So how normal kids are socially contacting, they will be fail in that. Impairment in communication, what the individual understands receptive language as well as what is actually spoken by the individual, expressive language, are significantly delayed in non-existent. So if a person is having a symptom, if a person is having autism, they will not be understand what is being told or what is being expressed to them. Impairment in behaviors, persons with autism often exhibit a variety of repetitive abnormal behaviors. They will say yes, 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 yes. So it will be repetitive behaviors, right? They may also be hypersensitive to sensory inputs through vision, hearing, or touch, tactile. These are the symptoms of autism. Autism usually is found in kids who are above than 3 years. It is diagnosed above than 3 years of age. Ritt's disorder. X-linked dominant in neurological disorders. Okay, effects. Wait. Okay, effects primarily. So Rett's disorder is again, which is mostly found in especially girls, a leading cause of mental retardation in females. initial normal development till 6 to 8 years. So initially in this disorder, there will be a normal development in 6 to 18 years, stagnation phase followed by rapid regression in motor and language skills. So initially after 18 months, it will be started rapid regression in motor and language skills. Motor skills means the activities done by hands and legs, and language skills while talking. Loss of purposeful hand use, they won't be able to use their hand uh, properly, replaced by stereotyped handwriting, screaming fits, inconsolable crying, and behavior reminiscent of autism. Loss of speech, panic-like attacks, teeth grinding, okay, rigid gait, tremors, okay. So they will be having that tremors, they will be having treat getting, okay. So these are the symptoms. Earlier, especially, it is more found affecting in girls, which will be by identified by screaming fits, or crying continuously, or having a behavior like autism, which includes like repetitive behavior, not making eye contact, not able to use properly their motor organs, legs and hands, intermittent hyperventilation, and microcephalia, small head. So usually even the structure proportion of head will be small as compared to the normal. Seizures occurs in approximately half of the cases. Getting faint and all. So half of the cases it also happen. Asperger's syndrome, neurodevelopmental disorder impacting behavior, language, communication, and social interactions. So again, Asperger's syndrome, in which it is neurodevelopmental disorder, where nervous system is not fully developed, impacting behavior. So because of that neurodevelopmental disorder, it impacts behavior, language, communication, and social interactions. As we all know that brain helps us in communication, decision making. So that's why when there is neurodevelopmental delay, so these all problems will be part of the autism spectrum. Spectrum, again, autism spectrum is group of disorders often seen in middle or higher functioning. Middler or higher functioning. Individuals typically possess normal to above average intelligence, challenging in social interaction, and tendency towards the intense interaction in specific topics. So they will have again like impairment in social interactions, like in autism, as it is like coming under that category only. So tendency towards intense interest in specific topic, whatever they like, so they will be playing in something repetitively, they will be doing that only. More prevalent in boys with a gender ratio of 5 is to 1. So 5 boys, the ratio is more in boys as compared to girls. 5 is to 1 is the ratio. Estimated to impact 2.5 out of every 1,000 children. Considering the total number of children with autistic disorders. So those who have autistic disorders, out of them, 2.5 are having this Asperger's syndrome, named after Dr. Hans Asperger, an autistic pediatrician. So he was a doctor who was working in Australia. So Australian pediatrician who was working on this disorder on his name's base. It got named as Asperger's syndrome, who first identified the condition in 1944. Dr. Asperger observed key traits including a lack of empathy. So these kids don't have empathy. They are having lack of empathy, difficulty forming friendships when there is no empathy, emotion. So obviously there will be a difficulty in forming friends. One-sided conversations. There will be one-sided conversation. Intense absorption in specific interests, clumsy movements. Okay, so as I mentioned that they will be engaged in particular thing for long time. Okay, they don't care. They won't even, you can't grab their attention from that to anything else. Then we have childhood disintegrative disorders, CDD, Hiller syndrome. It's also known as. Okay. Children develop typically until age 2 to 4, then experience a severe loss of social communication and other skills. So, loss of social and communication and other skills. Categorized under pervasive developmental disorders, part of autism spectrum disorder. Again, it is part of autism spectrum disorder. Involves a pattern of normal developmental development followed by a significant loss of language, social play, and motor skill. So, in this, there is a loss, significant loss in terms of language, social skills like making friends and all, play, they won't be able to, and motor skills. Again, they have motor skill related issues, utilization of hands and legs. Onset typically occurs later than autism. So, uh, once autism is the onset of autism is, I think, 3, it will be later than that. Involves a more dramatic loss of skill compared to autism. So so it has more loss as compared to autism. Less common than autism. It is very less common. It has more effect than autism, but it is less common than autism. Autism is now commonly. Loss of developmental milestones. Again, milestone means when, for example, a 6 month baby, what all average 6 months babies are supposed to do, whether the particular baby is able to do that or not. If he is able to do or she is able to do, it means they are within the consideration till that milestone. If they are not able to do, it means they are delaying with the milestone. Abruptly over days or to weeks or gradually over an extended period. Pervasive developmental disorder, not otherwise specific, PDD, NOS. So sometimes there are some disorders mentioned in both ICD and DSM where it is written not specified or otherwise specified. Okay, or it will be written unknown or something. Okay, where we the authors or the writers don't have more information about that. Okay, so we'll try to finish some more slides. Attention deficit hyperactive disorder, ADHD, which is again common, and it has comorbidity with autism. Among the most common childhood disorders persistent into adolescence and this. So in this they have attention deficit. Attention deficit is they are not able to pay attention, and hyperactivity. They will be getting very aggressive. That is what ADHD is. Causes of ADHD, again genes, environmental factors, brain injury, sugar, food additives. So this may be the reasons of causes etiology of ADHD. Then other childhood psychopathologies, oppositional defense disorder, conduct disorder, where stealing and all will be involved. Separation anxiety disorder, if they are separated from the parents and all. Tic disorder, childhood depression. So these are other disorders other than the above mentioned. Then mental retardation, very important, and like most of the kids have this as well. Developmental disability emerged before 18. So always mental disorder retardation we is supposed to be diagnosed before 18 only, defined by below average intellectual. So those who have less than average IQ are called mentally retarded or mental retardation. Yeah, now they are different term, differently able, right? Significant limitations in two or more adaptive skills. So there are different IQ ranges. If you see the average IQ range is currently 90 to 110. So 70 to 90 is borderline. Okay. Uh, 50 to 69 is severe. Then profound is less than 35. So that are different levels of mental retardation. In profound, they are fully dependent. They can't even do anything. Toilet training is lacking. Everything is lacking. They are fully dependent. In severe and other cases, borderline can earn. They won't be able to get high grades, but at least 10, 12 they can do. They can try to cope up with that. Then those who are mild, moderate, again they have difficulties. Okay. Severity levels. Mild mental retardation. 80% of cases IQ ranges from 50 to 75. Again, IQ again don't get confused with IQ ranges. So different authors, different books are giving different, but it will be little bit 5 points here and there difference. Here it has given, okay, so 85% of cases IQ 70 to 50 to 75 acquire academic skills up to 6th grade. So they can't perform more than 6th grade. They will then fail. Can be self-sufficient with community and social support. So they can be self-sufficient with community and social support if family is supporting and all. It is mild mental retardation. Moderate mental retardation, 10% of cases, IQ is 35 to 55. It is again like they need moderate supervision. Okay, acquire communication skills in childhood, function within a supervised community environment. So they need that supervision for everything. Severe mental retardation, 3 to 4% of cases, IQ is 20 to 40. Master based self-care and one some communication skills, can live in a home group home. So they fully need, like, mostly need dependence. If the family everyone is supporting, then they can survive. Profound mental retardation is 1 to 2%. IQ is under, like, below 25. Develop basic self-care and communication skills with support, often caused by accompanying neuropsychological disorder, requiring a high level of structure and supervision. So they are actually fully dependent. Causes of mental retardation: genetic, prenatal illness, infection, environment, and diagnosis. So most of the causes, if you see most of the psychological disorders, the cause is mental retardation. Sorry, this thing, genetics. Okay. Anxiety disorder and panic and phobias. Anxiety again is like nature of anxiety and anxiety types. Okay, anxiety versus fear. So fear is basic human emotion that you have to remember. Anxiety is not just emotion. It is something which will make you anxious about. For example, fear is basic human emotion linked to a real threatening situation, trigger fight or flight response. So here we can trigger fight and flight. If I see snake, I will either fight or flight. But in anxiety, there is a chance I will get stuck. I'm not going to take even decision whether fight or flight. Right. You might have seen when a person is in interview or some viva is going on, some kids used to get stuck. That is anxiety. They will have sweat even though in cold. Right. That's what anxiety symptoms are. Panic attack symptoms and clinical feature. Panic attacks are characterized by their unexpectedness. DSM-4-TR mandates that a person would be diagnosed as suffering from panic disorder if he or she had experienced recurrent unexpected attacks and is persistent concerned with having another attack. This condition must go on for at least 1 month. For each and every disorder in ICD as well as DSM, it is given duration. So how long it should be there. So this side it is symptoms: sweating, trembling, sensation of shortness of breath, lacking of choking, chest pain, nausea, feeling dizzy. Okay, these are all symptoms in even panic attack. Again, panic attack and anxiety. Some symptoms are mm, comorbid, right? Some symptoms are similar. Not required. Again, if you see factors, biological factors, genetic is called, psychological, learning factors, cognition, brain, and this. Okay, treatment of panic. Treatment we are not discussing here. Phobia, symptoms and clinical features. You might have heard about a number of phobias we have. Claustrophobia, agoraphobia. So the specific phobias can be divided into animal type, natural environment type, blood injury related. So it is categorized in different etiology of phobia disorder, biological factors again, psychological. So as I earlier mentioned, most of the psychological disorders have biological basis. Treatment we are not discussing here. GAD, general anxiety disorder, and OCD, obsessive compulsive disorder. Okay. So again, if you see, etiology is similar. Treatment Treatment again, for most of the psychological disorders, treatment will be therapy as well as for some when it is severe. For example, even if it is depression or schizophrenia, then in that case, medication is also helpful because medication helps us to balance the uh, this thing, balance our hormonal level. Okay, so that also helps us with that. Along with that, therapy is also playing important role. Again, OCD, similar psychological factors, psychoanalytic theory, learning theory, cognitive theory. Okay, treatment, we are now PTSD, post-traumatic stress disorder. Again, when there is some sort of trauma and uh, because of that, when a person is feeling, for example, floods were there in Kerala 2019, or last year Vijayawada also we had. So because of that, if some stress is because of that, that's what post-traumatic stress disorder. Okay, then we have biological factors, psychological factors, PTSD, SDDD. Okay, somatoform disorder and dissociative disorder. Somatoform again disorder involves physical complaints where actually bases are not there. And so body dysmorphic disorder. Okay, so as we have now 10 minutes, we will be having discussion. If there is any question on that, I will be sharing the PPT as well. Now I am expecting some questions from you all. Yes. Did you got the picture of psychopathology in broader way? I just want this 10 minutes to be interactive session. Interaction means two-way communication. Yes. Okay. Any doubts, any questions, any expectations which I can address now? Any feedbacks?
Sir, what it mean by seasonal affective disorder?
Seasonal affective disorder. So, seasonal affective disorder are those disorders. For example, you might have heard, yeah, in general disorders I will talk, then I will come to psychological disorders. So nowadays, here recently I have seen most of the people have this cough, so they are saying it is seasonal. Usually in March, Feb and March season change, or December it will be cold, so that's what seasonal is. some disorders which are related to that season. For example, we have spring, summer, autumn, winter, right? So same way, psychological disorder. There are studies which are saying some sort of disorders are more in winters than in summer. Some sort of disorders are more in summers or spring than in winter. That's what seasonal disorders are, which are depending on the environmental factors or the seasons. Yes. I hope you got the answer.
Yes, sir, I got it.
Any other question or feedback? I will be sharing PPTs with sir. Sir will share in the group. Right, sir? Sir is there. I think you have WhatsApp group, so sir will be sharing with you.
You can send it to Dr. Prasad Babu, sir. Sir will forward to all the learners along with other PPTs.
Sure, sir, sure.
Now he is in the other meeting, sir. He may be available or may not be available right now.
Sure, sure, sure.
So, okay, we will wind up now. We will join at 2:30 for another course, the MPCE 12.
Sure, sure, sure.
Okay, sir. Thank you.
Okay, so there is one question, paranoid disorder, right? Paranoid personality disorder, also it's called PPD, is characterized by persistent pattern of thinking and behavior that includes distrust, suspicious or jealousy towards others. So paranoid personality when unwanted distrust is there. Always, usually nowadays, people have that tendency of suspecting others. So when you are suspecting, okay, everyone will be like this only. So that's what paranoid personality disorder is, PDD. Persistent pattern of thinking are there and behaviors that include distrust, always suspicious, or jealousy. Okay, so you might have seen people who are very isolated. They feel everyone is selfish. They feel everyone is like this. Everyone is cheater. So that are the characteristics of PDD, PPD. Yes. Anything else?
Sir, but their experiences makes them to think in that way. But how can you conclude that? I mean, how can you
See,
diagnose that he belongs to PPD or she belongs to PPD?
so for any sort of psychological disorder, until and unless it is not hindering your life, for example, OCD. Usually, I will give you example of OCD. So I am checking my purse whether I am carrying my purse or not. If I check it once, no issue. Or if I checking fan whether I off my fan while leaving to office or not. If I check it once, no problem. If I am here, I am checking it 2 times, no problem. But it will become disorder. From office, I am coming back to my room whether I check fan or not, whether I switch off fan or not. Are you getting my point? When it is disrupting my daily routine. Okay. So same way, when a person is unnecessary suspecting each and every person, okay, this person will be a murderer or kidnapper or this thing with each and every one, and it gives them distress, that becomes a disorder. Until and unless it is not affecting your daily routine, normal. So I am not diagnosing. Okay, I said these are the symptoms, but we have to check how much duration is there, what are other symptoms are there, how many of them are following. Then only we will be giving the diagnostic analysis. Clear?
Yes, sir.
Good afternoon, sir.
Okay. Yes, good afternoon.
Sir, paranoid disorder and paranoid schizophrenia are both are same as not.
Paranoid and
paranoid schizophrenia.
Difference between which one you said are same? Schizophrenia and paranoid schizophrenia.
Paranoid disorder and paranoid schizophrenia.
Paranoid disorder and paranoid schizophrenia. See, no, these are two different things. Paranoid can be a personality traits. Paranoid schizophrenia is different thing. In schizophrenia, we will be having other symptoms as well, like hallucinations and delusions. So these are different.
Okay, thank you.
Okay, thank you so much, all of you. Have a great day ahead. Bye. So I'm concluding it here.
Okay, sir. Thank you.
Yeah, welcome, sir. Thank you.